My name is Belinda Foreman. I am a student nurse at MCC, and I'm going to be doing a return demonstration video on an intradermal injection. So, I just received an order from the physician. A patient has come in for a PPD, so I need to administer 0.5 milliliters of Manto intradermal and have the patient report back in 48 hours. So this order is for our patient Frank F. Furter, and I'm checking in the MAR just to make sure this all matches. And sure enough, Frank F. Furter has been roomed in 208 and is awaiting his TB test. So I am going to go to the med room and get my medication ready. So I'm going to wash my hands. And make sure I have the proper needle. And then I'm going to check my drug. I have the right drug, and it's not expired, and there are no weird particles or anything. Now wipe off the top of my vial with an alcohol wipe. And open up my syringe. And I'm going to pull, since I need 0.5 milliliters of drug, I'm going to pull 0.5 milliliters of air. I'm going to inject that right into the vial. And then I'm going to go ahead and pull up 0.5 milliliters of the Manto. And I got lucky this time and I don't have any bubbles. So I'm going to go ahead and recap. And when I go into this room, I am going to look for a place on the anterior forearm. It's the most accessible site and a good place to do this test. So I'm probably going to do about here on the forearm on Mr. Furter, far away from any veins or and sure to get our test results, but also not do any damage. So I'm going to head on down to Mr. Furter's room. Alright.
Hello.
Mr. Furter?
Hi.
My name is Belinda Foreman. I'm your nurse today. Can you verify your name and date of birth, please?
Frank Furter, 3/14/1950.
Great. Do you have any allergies, Mr. Furter?
Nope.
Okay. And so I am going to be injecting 0.5 milliliters of the Manto intradermally, and this is going to produce a little bleb is what we call it, but it's a bubble on your skin, and we're going to see if there are any reactions. We need to check this in 48 hours for those reactions, so you'll need to come back. Do you have any questions for me before I start?
No, I do not.
Okay. And I'm going to boop on your there for another check. Again, 0.5 milliliters. I'm going to take the cap off. And then I'm going to go at a 5 to 15 degree angle, level up. I want to go under the skin so that I can still see my needle, but it's deep enough that I can inject this medication and it will stay. So as you can see, we now have a wheel here, which we will be watching for any reaction. And I'm also going to do a mark around this wheel. Sometimes they disappear, and so we don't know where we're looking for our injection at all, so that will help us mark it. Frank, do you have any questions for me?
No.
How are you feeling?
Wonderful.
All right. Well, the doctor will be in to see you shortly, and we'll see you in about 48 hours.
Sounds good.
All right, thanks. So now I'm going to go over to my MAR and just document that I did an intradermal injection for Mr. Frank Furter in 208, 0.5 milliliters of Manto, and that we'll be seeing him in 48 hours. It is 1900 hours and 2/12/2020. Signed B. Foreman, student nurse.